Digitising Rotherham's health and social care services. People use digital technology to support them in a whole range of aspects in their life, and the NHS and public support services across the whole country are reforming how technology is used to support people in managing their well-being. We want everyone involved in health and social care to be able to access information when they need to. We want people to be able to see and contribute to their own records, so they have control over their own information. Obviously, there are strict rules over who can see sensitive information, but by making information easier to view, everyone can see the full picture of what's happening to them or the person they are looking after. We are calling this the Rotherham Health Record. The aim of this is for services in Rotherham to be digital by default. The plan to how this is going to happen is called the Local Digital Roadmap, and it forms a key part of the transformation of health and social care in Rotherham. Appointments can already be booked online, and patients can already receive digital reminders so they don't forget when their appointments are. But there is a lot more that we can do. For example, supporting a diabetic in remotely monitoring their blood sugar and aiding in dietary advice. Digital tools that help direct a person to the right place to access the NHS, avoiding wasted journeys, and supporting people with mental health issues to help speed their recovery. The improvements in technology not only allow us to get to patient information more quickly, they also allow patients to see how their local services are doing so that they can make more informed choices. It's now possible to see the waiting times of various services online, so we know what to expect before we turn up. All of the helpful digital tools that we are all familiar with to do things like planning a holiday or speaking to friends online are now being applied and adapted to make our services more effective. Where possible, GPs and patients can join virtual clinics to discuss issues, rather than always having to arrange face-to-face appointments. Virtual wards can operate, where people are treated by the same care team as they would have had in hospital, but in the comfort of their own homes, with their conditions being digitally monitored and their information available through the Rotherham Health Record. Deciding on suitable treatments and the best course of action gets much easier too. Patients can see clinicians accessing all their relevant records of care so that we don't duplicate what we do or keep on asking people to repeat information. Clinicians prescribing drugs can see an alert if they're offering something which is incompatible with a drug that the patient is already taking, and alternatives are suggested by the system. Electronic prescriptions help eliminate errors and reduce time. By reducing paperwork, we can release doctors to do what they do best. Voice recognition technology allows doctors to dictate prescriptions or record surgeons' notes while their hands are busy with the operation. If someone needs support which isn't entirely medical, like encouraging patients recovering from depression to go to an arts or sports group to build up their social circle, there is a list of possibilities to choose from. Our new technology can make suggestions which are appropriate for the patient and tell them where and when to go. Using all this data, we can pinpoint our resource to who is most likely to need medical or social support using technology. Then we can act before it gets to crisis point and deal with problems earlier. This might be through diabetes clinics, for instance, or something as simple as encouraging people to use apps on their mobile phones to do things like accessing GP services out of hours and living a healthy lifestyle to stay fit and well. New technology is not only benefiting patient-facing services, better tracking and scheduling of staff will ensure the right person gets to the right clinician at the right time. A system to display available beds across the whole Rotherham health and social care system helps place those in need in a suitable setting and ease pressure in other areas. To make the local digital roadmap work well, we need to have up-to-date hardware and good, secure, high-speed wireless networks so everyone can access data quickly and easily. One way of doing this is by sharing connectivity between organisations. For example, NHS staff may need to work in council-operated care homes, so by sharing Wi-Fi, they can easily get on the network in that setting. We want Rotherham's health and social care system to support people and their families across the borough and use whatever elements of technology they are comfortable with. So we'll be constantly looking for new, innovative, proactive, useful ways to improve how we care for our residents, using the best that technology has to offer to maximise their health and well-being. Thanks for watching.